Recording in progress.
What's that?
Recording in progress.
Great, thank you. Okay, so today we're going to talk about an introduction to the school-based health services pilot and the participation criteria. We'll talk about the pilot roles overview and tentative pilot timelines, the RFI timelines and application preview, and then we'll do some more we'll make sure we do Q&A throughout the session. So we have a meeting resource that we created, and Jennifer's going to post this in the chat. It is going to be a worksheet for you to kind of use as you like throughout this session. So it'll kind of be a way for you to jot down folks you need to talk with at your district, folks you want to get buy-in from, and other information that you kind of want to follow up on as next steps after this meeting. So it's completely optional, but we thought it might be helpful as you kind of learn more about the pilot today. I'll just show you really quick what that looks like. It's going to have kind of what the initial buy-in steps are, and then you'll be able to write down who needs to be included in those topics. So who needs buy-in, what resources might be needed, and when do you want to do that by, kind of helping you plan for those next steps after this meeting. Okay. So today's goals, after this session, you will have a better understanding of who needs to be involved to be successful in implementing the school Medicaid program. And you'll have a better understanding of the 2-year pilot and whether your district wants to participate. So Jennifer, that's you.
All right, so just an intro to the pilot. The pilot is designed to support education agencies from end to end with implementing school Medicaid billing. So it will include enrolling with OHA, Oregon Health Authority, as a school medical provider, and then submitting claims and receiving payment. So participating districts will have the opportunity, to participate in the pilot with support and training from our whole team. So that includes Oregon Health Authority, ORMED, Oregon Department of Education, and the West Ed teams. And then receive services from MESD for ORMED at no cost to the district through June 30th of 2027. And then districts that participate will be part of a cohort group. So we'll be able to have some networking, sharing ideas, and keeping the momentum up for the entire group and learning from each other. And our goals for the pilot, we want to onboard education agencies that are not currently participating in the school-based health services program. Pilot a process that guides education agencies through the onboarding and implementation steps for building that sustainable school Medicaid billing program. And then, of course, increase Medicaid reimbursement among education agencies in Oregon. Participation criteria. So we're looking for education agencies. This could be a school district or an education service district that is new to school Medicaid billing, just starting the process, or has not recently participated. And then some expectations. So once districts are participating, they will need to assign a lead administrator role. They'll need to assign a Medicaid coordinator to kind of coordinate all the moving pieces and make sure things are moving forward. Enroll with the Oregon Health Authority as a school medical provider. Contract with Multnomah Education Service District and ORMED for billing submission. And then also commit to actively participate. So there's going to be planning meetings, check-ins throughout the 2-year pilot, and lots of training sessions. So committing to that, and also committing to submitting information as needed to either OHA or to OHA and ORMED. So whichever one is needed. For example, we do a rate setting, a cost-based rate setting. So districts submit their costs to OHA so that we can complete that process and set up the financial piece in MMIS, just an example. And then data sharing also with ORMED. And I will turn it back over to Leanne for pilot and RFI.
Thank you. So just kind of to recap again, the 2-year pilot is going to focus on creating buy-in with your district, moving through the onboarding steps as a cohort, and providing timely training and support for all the districts. So it's really meant to, districts and education agencies are starting at the very beginning of the process, and we're all kind of moving together through all of those onboarding steps. And as we kind of learn together, like what types of training might be needed, technical assistance might be needed, we'll all work on that together with support from ODE, OHA, WestEd, ORMED, and kind of making sure that that everybody's on the same page. So this is just kind of a quick kind of view of what type of support the OHA, ORMED, and ODE WestEd teams are going to provide. So OHA is responsible for pilot oversight, and they'll be providing the Medicaid 101 training with support from ODE and just training and technical assistance related to OHA processes. So that's kind of their role in the pilot. The ORMED team is going to help with creating custom onboarding plans and kind of helping implement all the steps. So it's going to integrate all the requirements, even the OHA requirements to get enrolled and that kind of thing. It's going to integrate all of the onboarding steps, and we'll help make sure that you're moving through. And if you're getting stuck, we'll kind of help make sure that you have the support you need. We'll lead the student information system integration. So we'll work with your tech teams to get that integration going, make sure the extracts are set up, get that nightly data flowing between your SIS and ORMED. I personally am the escalation point for the customer service team. And then I'm also the liaison with our development team that works on ORMED. The customer support team is going to ensure when we're doing that data integration, they're doing that data quality assurance to make sure that all the data is flowing the way we want it to. They're going to provide ORMED training and support, and they're also going to do the monthly billing submission. So they're really kind of that first line of support for all the district providers that are doing the billing, as well as the Medicaid coordinators to make sure that everybody's got what they need. And then WestEd and ODE are in a strong supportive role. So they'll be providing technical assistance, training, kind of as needed with all of the various resources that are coming out, just making sure we're integrating those. And so we'll make sure that those are a part of this pilot as well. And so we also wanted to talk about the EA team, so the education agency roles, and making sure that there's cross-departmental buy-in across the EA teams. And so we've got, student services, SPED, health services, the business office, tech services, and a Medicaid coordinator are all going to have really critical roles in this pilot, but that doesn't mean it's all throughout the pilot all the time, right? So we kind of wanted to give you an idea of where do these folks come into play when you're onboarding, setting up, and then ongoing. So ideally, there's an administrator that has helped ensuring commitment up front with the district, getting buy-in from all these different departments and making sure everybody's aware of what's going on and what's needed. And then ensuring that buy-in maintains over time. And then the licensed providers, we need initial buy-in from them. And so there needs to be kind of an effort to get those licensed providers aware of what's going on, what processes might need to be improved upon or changed, and then making sure that's happening. And then also ongoing, once billing starts, that they're really bought into billing and there's that accountability to make sure billing's being entered. For business office and technology services, the business office really needs to make sure they're setting up those fiscal processes that are going to help make match payments quickly, that they know that there's cost rate development that needs to happen every year. So making sure that there's strong buy-in there. Developing those routines in the fiscal office and just making sure everybody's aware of those things. We've also got the technology services side for that data integration piece. So really it's just that initial setup and implementation with the tech team, but making sure they're aware that this is something that is going to happen so that they can plan resources for that ahead of time is really the critical piece there, because it takes time to pull that data, make sure it's flowing through correctly. And once that's done, that's basically the tech services role in that. And then there's the Medicaid coordinator, which is kind of tying all of this together, right? There's ongoing activities to make sure all the various tasks are completed, making sure all these roles are completing the tasks, and also just making sure progress is being made. If progress is stalled, that Medicaid coordinator is a really great person to make sure that we get the support and resources that role needs to make sure we can keep moving. With all of these different roles, you may imagine a lot of things can fall through the cracks. And so we're really trying to make sure that there's this buy-in across all these departments and making sure that if something falls through the cracks, we know what it is, we know what happened, and we can get that support so that doesn't create that lack. It impacts momentum, right? It kind of stalls things and it gets kind of it can get messy. So really making sure that buy-in is at the EA is critical here. Okay, so for some timelines, these are just kind of tentative timelines that we put together. So the idea is in May of this year, we will start the onboarding process. And so from May through January, there's various planning, setup, and implementation steps. We'll be creating the Medicaid teams at the education agency. We're going to start getting buy-in from folks. We're going to be doing technical assistance and support and a bunch of onboarding steps. All of that work is so we can start getting training and billing in February or January so that staff can start billing in February. So the idea is all of these steps will be completed so that billing can begin in February 2026. That's when the monthly submissions will start. And ongoing, there's going to be training, technical assistance, and support. So we're going to help create a really detailed implementation plan for all the pilot districts so that everybody knows what needs to happen and who's doing it and when it needs to be done by, so that we can all be ready to start billing in February of 2026. In terms of the pilot RFI timelines, so today's the info session. Next week is spring break for most of us, I believe. And so the RFI application will open the week that school resumes. So around the 31st of March. It's a 3-week period where those are open. So that's when districts and education service districts can work on that RFI. It's a questionnaire, and we'll show you a little bit of what that looks like in a minute. So there's 3 weeks to fill out that RFI info. We're calling it the RFI survey. And then applications due April 18th, and then we'll notify, there's going to be kind of a process to review them. And then we'll let districts and ESDs know who's part of the pilot by May 12th. So this is what the survey snapshot. So what we're trying to do with the RFI survey is try to we modeled the questions after the readiness tool that OHA and ODE created. So we created the questions using a couple different steps in the readiness survey. And so it's really part of the work is trying to help you understand, like, have you done some of the steps already to get buy-in? Have you enrolled with Oregon Health Authority yet? And kind of questions like that. And so we're really trying to seek, where are you in the process, and kind of, have you done those buy-in steps to be successful for the pilot? That's really what we're trying to make sure, is that, have you done that initial work? Because when we start in May, we're assuming a lot of that, at least the intention of the buy-in is there, right? Like, have you started doing that work to make sure that buy-in is starting to be built? So that's really a lot of what this survey is about. And I just want to make a note here. This survey process is not to find the most ready EAs. We know that this is meant to be at the beginning steps of the process. So we're really just evaluating or looking at, where is everybody in the process, and trying to get a good idea of how we can support the districts and where they are in various stages of readiness or buy-in. So your answers to this, it's really just about getting information from where you are now. And even if you don't know where you are now, that's okay. Just let us know that in the survey. Let's see. So next steps and resources. So many of you may have gone to the Medicaid 101 training session that West Ed did this week. And so that is going to be available soon. And so you may want to, if you didn't attend that, you may want to attend that, watch the recording of that session. Use the readiness tool and the EA planning worksheet that we sent out today to kind of help you kind of determine who do I need to get buy-in from, who's going to help me decide if we're going to apply for this pilot, and making sure that everybody's aware of what's required if you are going to participate in the pilot. And then just be aware that March 31st is when the email from Oregon Health Authority will come out with the RFI questionnaire and all of the resources that we have for you to apply with those instructions. So that's about it. So Jennifer, do we have any questions that came through in the Q&A?
Yes, we do have a couple of questions.
Great.
Do you have any idea how many pilot participating districts you can support?
So at this time, we're planning for 10 pilots, 10 districts and ESDs to participate in the pilot. That's our plan at this point.
And if we are participating in MAC claiming, but not SBHS billing, are we eligible for the pilot?
Yes. So even if your district is participating in MAC, that's completely fine. If you're new to the school-based health services direct billing side, that's the criteria for this pilot.
And the third question, how is this different or the same as school-based health centers and school-based mental health, behavioral health clinics or clinicians or clinics provided by Multnomah County? I know that those services are currently being considered for cuts at schools.
Jennifer?
All right. Yes, absolutely. So definitely an Oregon Health Authority question. So the difference is school-based health centers and the mental health organizations, behavioral health that you mentioned, those are clinics that are operating on or close to campuses. They are clinically driven. School-based health services are services that are being provided by education agencies to children and young adults in attendance or in the community as required by IDEA, Section 504, and to the general education population as well. So those are services that the education agencies are providing to support a child or young adult's education and learning. Whereas those clinics, it's very clinical to support clinical outcomes, not education outcomes. So that's where it's divided there. The school specifically is providing services versus the clinic. And hopefully that was clear enough. If you have more questions, let me know.
And are small districts encouraged to participate in the pilot program, or is this geared more toward ESDs and large districts?
Definitely geared towards all. So if you're a small district, please, and you want to participate, please submit that RFI survey. We're looking for a variety of different sizes, different areas of the state, ESDs, school districts. We're really hoping that we're truly treating this kind of like a pilot. Like, what would it look like if we did have this kind of cohort model of bringing folks through together and providing that really just-in-time technical assistance? And that's for lots of different types of districts and ESDs. And so we're really hoping to learn from this. And so the more variety of different sizes and geographic areas would really benefit the work of the pilot. So please, if you're interested, please submit an RFI survey.
And under this project, are non-clinical providers, such as community health workers and peer support specialists, allowed to bill? If so, would they be under the same OARs as fee-for-service?
So the providers are listed in the Oregon Administrative Rules. That's OARs, just in case anyone needed that acronym spelled out. So the providers that may provide the services that are billable for school-based health services are listed specifically in the Oregon Administrative Rules, and they do not currently include the group of providers that was listed in the question.
Is there an estimated time commitment for the SBHS Medicaid billing pilot? Hours per week? Question mark.
Hard to say. I'm going to go back to this. When we, this is a hard question to answer. It takes time to, when you think of enrolling as a Medicaid provider with OHA, there's forms that need to be filled out, and there's the authorized signer that needs to sign off on it. So a superintendent or a business manager would have questions depending on who the authorized signer is. So it's kind of like however long it takes to complete those tasks is really what that time commitment is. Up front, there's definitely a lot of setup, but I wouldn't say this is a full-time job, that it's like a full-time every day during the week kind of thing for like a Medicaid coordinator, because there's different pieces that different folks have to take on. So it's hard to say what the time commitment is per week, but it's definitely kind of a bigger lift up front to get everything set up. And then over time, those setup activities go away, and now you're kind of just implementing the program, and there's monitoring activities that you'll want to do. Like maybe once everybody starts billing, you're making sure that folks are entering their logs and providing that support if they're not doing that. So there's kind of those monitoring activities that would need to happen once the program is set up. But we're really trying to provide you with all of the steps are going to be outlined for you. And so you'll be able to assign different people, different tasks, and then just kind of keeping up on that and monitoring over time to make sure that they're completed. I'm not sure if that's, Jennifer, do you have anything you want to say about that? It's really hard to say, but we're really going to try and help kind of take away some of those, what am I supposed to do next? Because that takes a lot of time too, right? Of like, where am I? Or maybe you don't know what you're supposed to do next, and that takes a lot of time and it stalls you, right? So we're really trying to help make sure that we know what the tasks are, we know who needs to do them, we know what the due dates are, and we're going to be monitoring that over time, and hopefully that reduces the amount of time it takes to set your program up and get started with billing so that you can start to see that reimbursement come through, because that gets momentum going too, right? That billing process, that the active part of billing gets that momentum. I think that's all I'll say about that. Yeah.
When are TSPC licensed staff going to be eligible for Medicaid billing?
So we're currently in the process of researching and gathering information on TSPC, scope of practice, documentation, those kinds of things, so that we can effectively add them to the rules if it's appropriate. We're also looking at a comparison between what these providers may be claiming to MAC, and just making that distinction between Medicaid administrative claiming and direct billing to make sure that there's no overlap in either of those things. So we're hoping for sometime this year, but we will keep you posted on how that's coming about over time.
All right, thank you. What was the OAR where those providers are listed? I assume this is the providers that are allowed to currently bill in the pilot.
I will get that number for you right now. I know the beginning of it, but I don't know the particular rule number. So give me just a moment.
Would it be possible for an ESD to apply in partnership with a component district or districts for the pilot?
So in that example, I'm assuming an ESD would apply for the RFI to be part of the pilot, and then they're going to be working with a number of their component districts on billing, is what I'm assuming. So I think that that's definitely acceptable because I think the whole purpose of ESD's billing is that I mean, in order for ESDs to bill, they have to have an agreement with their component districts. And so I think, so the answer is yes. We would assume that there would have to be some kind of arrangement or agreement between the ESD and the component districts. And we all know, those agreements, agreements that we set up with between ESDs and districts can all be unique. And so, as long as those agreements are there and that buy-in is there and the district is agreeing to participate, I would say yes, that would be an acceptable participation route.
Yes, the person asking the question confirms that that is what they were envisioning. So
I would say if you're an ESD that wants to participate, getting buy-in from your districts is going to be critical, and doing that as soon as possible. Because those agreements can take some time. There's kind of some negotiation there and some questions and wonderings between the ESD and districts of how the program will be set up. So if you have those kind of lined up, those agreements lined up, I think it'd be a great thing to pilot, is trying to figure out how that's going to work.
and ESD is asking, or a representative from an ESD is asking, do you have sample MOUs between ESDs and school districts as models for this?
There isn't an MOU that I'm aware of. The Oregon Health Authority has provided elements that would be recommended for an MOU. I believe that was from the first webinar and provided in September, and those FAQs and the webinar information is on the OHA website about that. But the OHA put together a whole list of what are the agreements that need to be made between the ESD and the school district, and I think that's a perfect template for an MOU, because every district and every ESD and districts are going to have different agreements. But I think that's a good starting place for creating that MOU. But a template, I don't believe a template exists right now. Jennifer, do you have anything else to say about that? Okay.
Another question's come in. Our district has been enrolled in school-based health services billing and has been successful in the past. With the loss of staff and staff changes to our program has fallen apart. This year, we have a whole new team that is taking on the responsibilities with no prior training or information. Should our districts pursue applying for the pilot program?
So clarifying question, is your district stalled out with billing, as in you're not billing at all right now because of these changes, or are you continuing to bill and those processes are all actively working?
If you wanted to
it's
put
hard to.
your
How about
answer.
I'm thinking that might be, I would say, Jennifer, what would you say?
I would say fill out the RFI, and in review, we'll get there to who would participate or not. And I can't imagine that the request for information is going to it'll take a long time to get the background, I guess. But yeah, I would say go ahead and send us information, and if we can, we will.
And I would say in that scenario, when you fill out the RFI, there are a couple of, maybe we can add like a questions or wonderings or section, kind of a free form field where you can kind of just tell us those kinds of scenarios, like a unique scenario that you're wondering about or that kind of thing. That would be helpful for us. Because really what we're trying to figure out is complexity, right? Like with the 10 districts that we're picking, that are going to participate, it's kind of like, how complex is it going to be to get this moving for districts? Some situations are more complex than others, and that could be a stall for the onboarding and continue to move forward. So I would say, just like Jennifer said, submit an RFI and we can go from there.
It's been requested that you move one slide back in your presentation, Leanne, if you wouldn't mind.
This one?
I believe so. A couple more questions. If an ESD has an NPI for EIECSE, but is in the process of obtaining our NPI numbers for school-based IDEA and non-IDEA, is the ESD eligible for the pilot?
Yes. So if your EIECSE program is already participating, and it's your K-12 program that you want to get started, you can still apply for the pilot because it's a completely different process, and you've got to get started for everything that you do for the early childhood billing, you've got to do for the K-12. So yes, if you do early childhood billing, you can still apply for the pilot.
Could you move back to slide 17, please? Okay. Since a question from the group, since the school-based Medicaid expansion is a federal grant program, is it likely to be impacted by the current proposed Medicaid cuts by the federal government?
So what I can say about that is we're moving forward. We are continuing to implement. We have approval to move forward with Medicaid expansion. The grant specifically is to assist with that expansion, but our rules are in place with expansion. So we are moving forward.
Thank you. We had participated in reimbursement a few years ago, then left the program due to the challenges with many changes in coding requirements. Would ORMED support training with changes to coding requirements as they come up? We often found that we didn't know that codes were changed until it occurred, then had to recode many services.
I'm not sure about that scenario. I'm assuming coding is maybe procedure codes, diagnosis codes. This is definitely a topic that I've been talking with Jennifer about, is trying to get better or more documentation or more training out there about procedure codes and diagnosis codes. So if that's what that's referring to, yes, we are hoping to provide more technical assistance in training on those topics.
Those are all the questions we have currently.
Great.
Okay. And the questioner clarified that it was procedure codes.
Okay.
So
I wonder if that was when there was a big change a number of years ago where there was a change in, I think there was a lot of codes at one time, and then they repaired them, like they were pared down by the state. But those codes are state codes. Or Oregon Health Authority puts those codes together, and there's certain ones that are available for school-based health services. So yes, we will definitely make sure that there's training around those codes and provide technical assistance on that as needed.
do you know how many school districts in Oregon currently participate in SBHS Medicaid billing?
So about 25% of districts are participating at this time.
That's all the questions currently.
All right. Maybe we'll stay for another minute or two. See if any other questions come up, but we don't have any other presentation. So if you feel like your questions have been answered, feel free to drop off. And we'll just kind of hang out here for a minute, and we'll stop recording now. Jennifer, do you mind stopping recording?